yesterday was a holiday, so we didn't have my friend Dr. Drew in. So we've invited him in this morning. Good morning to you. Thanks for coming in.
Good morning.
Okay, so I had my appointment on Friday. There's a lot of things that I want to discuss this morning. I guess we're going to have to do this in chronological order. First off, what was it that we were going to do? What were we doing on Friday again? What was the whole exercise?
Well,
Is getting rid of...
Step one, we had some old silver fillings that were breaking down that we replaced.
Okay, so I had to go in on Friday to get the old silver stuff taken out, and it's replaced with some... What do you guys use?
It's a composite resin, basically a combination of plastic and glass.
And it's white, so you can't see it. Because when I open up my mouth right now, you see a lot of silver. There's a lot of silver going on.
A lot of silver, huh?
Yeah. So we had that done. So first off, I guess what I'd like to discuss is a couple of things, because I'm really impressed by this. You haven't been in Dr. Drew's office, but they got big plasma screens set everywhere, right in front of the chairs. So when they take a photo of your mouth or your tooth, what's going on, like they're telling you and talking about, here's what we think you need. Boom, it's right up there in front of you on this big plasma screen TV.
Oh, wow.
Okay? So
awesome.
these are photos that I got in my hand here of my teeth that you're actually seeing on the screen. Why do you think it's so important for people like me when I'm sitting in the chair to see what you're looking at? Is it so when you're talking me through all this, why do you do that?
Any time that you can be involved in sort of the treatment that's going on as well as the diagnosis, it just makes it easier for the patient to grasp what's going on. And so, a picture says 1,000 words. You mentioned when you saw the hygienist that you had a couple of pictures up there, and they show bleeding gums.
Yeah.
You can tell someone bleeding gums, but unless they actually see it in their mouth, it may not register the same way. And so, because of a lot of what we're dealing with doesn't hurt until it's too late.
Right.
It's helpful to sort of have these aids to sort of show along the way. So he's like, oh yeah, okay, I see what you're talking about.
Dude, don't take this the wrong way, but I think a lot of people, I've experienced this myself. The dentist is telling you what you need. There's a little voice in your head going, no, I don't. I don't need. He's just saying I need that. I don't need that.
No.
But when the proof is right up there on the TV and you're like, whoa, that does not look good.
Well,
it was helpful. It's helpful.
The analogy I guess I make is that, I lost a lot of weight last year, and standing in front of the mirror was all I needed to know. That the doctor told me for years and years, but when you see it in front of you, it's hard to argue.
Okay, so I like that. I like that a lot about the whole thing you got going on there at the shop. Okay, here's the other thing: is that I know that the silver fillings are unsightly, but what did you find when you took out my silver fillings? Because I'm looking at the picture right now, and I can actually see it. What's going on once you took out my silver filling? What was going on under the silver fillings?
Well, the areas that we worked on Friday were relatively small in terms of the size of the fillings, but even with that, we saw a very obvious crack, and we saw decay underneath.
So is it safe to assume, does that happen often? Is there decay? You would think it's a filling, so there shouldn't be decay under my filling because the tooth was dealt with.
Yeah, well, a common question is, how long is this going to last? And the answer is, silver fillings do last a long time, but unfortunately...
They break down?
Well, and they leak because they don't actually bond to the tooth. And so underneath most of the silver fillings that I take out, I find decay. So when you're talking about restorations, there are a number of ideal properties. One is how long it's going to last, and silver fillings do last a long time. Can you chew on it? Sure. But there are other things like, is it conservative? Silver fillings, you have to take away more tooth in order to put them in. Is it biocompatible? You'll see gum tissue that it bleeds just in response to being in contact with metal. And, white fillings do actually bond and help reinforce the tooth instead of just plugging the hole.
And they look better, Mel. Look at my mouth right there. See that? That's the before and after right there. It looks better. But I was surprised here because the tooth felt fine. It had a filling. It felt fine. And then I find out it's cracked, actually, and it has decay under there as well. There's another thing that I want to talk about as well, because I'm a pretty big guy. I'm like 225 pounds. I like to come across as kind of a tough guy, but I'm not great with pain. But I gotta say, there was zero pain, zero discomfort.
Really?
Yeah, and I had, obviously you gotta freeze me with needles for this procedure, but I didn't feel them. What do you guys do there? You get a swab out? Are you just desensitizing? Yeah.
It's a topical gel. Orajel or any of those products you'd find at the drugstore. It's just a stronger version of that sort of pre-freezes the gums to make it a little bit easier to tolerate the
Then
procedure.
you do your thing with the needle, then you can do your procedure. And the reason why I want to say that, I want to make a point of this, regardless of whether you decide to go Dr. Drew or not, I just want anybody who's listening out there who is not going to the dentist because they're afraid of pain, don't be. Do it. It's pain. There was no discomfort at all. There was no discomfort at all.
There's a huge population, even in my practice and in everyone's practice, where 20 or 30 years ago, as a kid, you might be worked on without freezing at all, or held down and all kinds of stuff. And so you're not alone if you're in that category.
All right. So we had the silver fillings replaced, and then the white stuff put in as well. I guess this is pretty typical. Is my mouth a pretty typical mouth as far as all this stuff goes?
Yeah, I mean, the silver fillings, again, they've been around for a long time and they do last a long time. But part of the other issue is that, someone quoted me a stat that in 1960, the average 64-year-old person was dead. And so people are living a lot longer.
It's a cheery thought.
But people are living longer, they're living better, and they're keeping their teeth. And so where silver fillings maybe only had to last until you were 50, until you got dentures, that's not the case anymore because we're addressing the periodontal disease as well. And so we're having good bone support, and we're wanting to live longer and live better. And so keeping your teeth is a part of that.
So here's the other thing that I really want to say. In all honesty, I think your staff are fantastic. Everybody was checking in on me, and I'm getting the sense it's not just me because I'm there. They do this with everybody. Everybody was fantastic. And the other thing that I wanted to say was, and when I say this, I'm not sort of casting dispersions towards any one particular person, or I have been to the dentist in the past where I've had a procedure at 3 o'clock in the afternoon. Mm-hmm. And by 9 o'clock that night in a social situation, I still can't talk because my whole face was completely numb, like 5 hours later, and my lip is droopy. What did I say? Remember what I said to you when I was leaving the office? What did I say to you? I said my face. Yeah, I could barely feel the freezing anymore. Like I felt kind of normal walking out of the. Good. So I'm just, for me, I guess it just shows the difference between some and others. That's all I'm saying. I know it. I'm making Drew feel uncomfortable now. But it was good. All right. So what's next for me? Where are we going here?
We're gonna do some bleaching.
All right. We're gonna try to fix this smile. I know. And we'll for sure get before and after photos. And you should check out Dr. Drew's Facebook page. You guys are very close to launching a brand new website, but you can check out the Facebook page, right?
And if anyone has any questions that they want you or I to answer for next week, they can go ahead and check out the Facebook page and drop us a question there.
Post a question on the Facebook page. Dr. Drew just might answer it for you. And as I said last week and the week before, man, if you're putting stuff off, don't do it, because I found that I thought I had a pretty healthy mouth. It turns out I got some stuff going on. I've got some stuff going on. All right, but I'm glad that we're fixing this. Thank you very much for coming in this morning, and I guess I'll see you in the next couple of days.
Sounds great. Thank you for being a great patient.
Dr. See? It's so nice. You see that? Dr. Drew, check him out on Facebook, and Dr. Drew Markham. He's in Huntsville, and I'll continue to give you updates as to how my smile makeover is coming along, okay?